Hello, Namaskara. I am Dr. Guruprasad, consultant neurologist at Columbia Hospital, Yeshwanthpur, Bangalore. In this video, I am going to share some information about epilepsy, and this will be important for patients and caregivers, families with patients with epilepsy, how to live with epilepsy, important tips, do's and don'ts in patients who have epilepsy, and when they have seizures, what needs to be done, what not to be done. So as you all understand, epilepsy is a very common neurological disorder. It is epilepsy, we call epilepsy for patients who have more than two or three seizure episodes in their lifespan. And epilepsy happens for various reasons. The commonest being primary epilepsy, where there is no specific structural correlate in the brain. When you do a scan, normal scans, usually the brain scans are normal. But there are situations where you can have epilepsy secondary to various other systemic problems. You can have liver-related problems getting seizures, but they are not actually epilepsy, but they are all seizure disorders. You can have one or two isolated episodes of seizures. So epilepsy is more than two or three episodes of seizures. When you have seizures, so what are the type of seizures you expect in patients with epilepsy? So you can have very commonly, people who are aware of seizures, when they say seizures or fits, they say when you need to have this tonic-clonic movement. So that's the commonest we understand. These are there. The patients will have generalized jerky movements of the limbs. They become unconscious. They fall. These are the common type of scene what we see in a type of seizure. But there are other types of seizures which we call as partial seizures or complex partial seizures, where you don't see this type of generalized tonic-clonic movements, this type of jerky movements. You can have just head turning to one side, eye turning to one side. You can have just some lip smacking movements, some involuntary movements of the lips. You can have some dystonic posturing, that is abnormal posturing of the hand. You can have raising abdominal sensation. You can have some abnormal thoughts, or you can have restlessness and very brief inability to speak or inability to understand, and then within few seconds or a minute you can recover completely. So there are different types of seizures, what we call complex partial seizures, where you don't need to have generalized tonic-clonic movements, which we commonly accept as seizures. So the people should understand that wherever there is episodes of unresponsiveness, or where you lose contact with the external environment with any additional movements or additional behavioral changes, you still can have seizures. So important is to, when you see this type of things happening again and again, you need to think about possibility of epilepsy, and you need to see a doctor. That's one thing, important thing. And there are certain seizures which can happen only in the nights. If you see a child, or if you see an adult who has these episodes recurrently in the nights during sleep, where they make loud sound, they have this abnormal posturing of the limbs during sleep, they fall off from the beds, then epilepsy needs to be considered and needs to be taken to a neurologist, and appropriate treatment has to be taken. So this is part of the type of seizures and all. There are also thing is whether there are certain age groups which can have epilepsy, but epilepsy can happen in all age groups. You can have children or neonates, children, adolescents, and then middle-aged or elderly who can have epilepsy. But important is the etiology for epilepsy for different age groups differs. So usually patients with less than 1 year of age, that is neonates, usually have mostly secondary type of epilepsy or infantile seizures, which are usually related to maldevelopment of the brain. Whereas there's something called childhood benign epilepsies, which happens usually at the age of 5 to 10 and all, where usually there are a couple of episodes and then usually they grow over it. Or there are certain seizures which are associated with fever, like for example these are called reflex epilepsies, which happen usually below the age of 5 years. These are called febrile seizures. So they are usually associated with temperature, fever, and we usually tell the family, the parents, that the temperature needs to be controlled, the fever needs to be controlled, and even without anti-epileptic medications usually this can be controlled. But if they get more than a couple of episodes and happens more frequently, or if there is a prolonged episode, we call them atypical febrile seizures, and that needs to be medicated to certain age group. So important is to understand is the epilepsy or seizures can happen in any age group, but the etiology and the reason for epilepsy differs, and the type of epilepsy also differs according to the age group. Whereas in elderly, you can have epilepsy or seizures related to head trauma, you can have epilepsy related to stroke. So there the type of the approach, the medications little differs as compared to vis-a-vis a person in the middle age or in childhood or an adolescent who has primary generalized epilepsy. The type of medications, the type of investigations we do differs in these things. So, and another thing what we need to understand is what is the complications or what are the risk of epilepsy, and what if a patient has multiple epilepsy, and why the question comes. Most of our patients also ask this question commonly, that why we need to treat epilepsy further. If there is an isolated episode, why do we need to treat them? Because they happen randomly, once in a year, once in 2 years. Why we need to treat them with so many medications and for so many years? The problems of epilepsy or problems of seizure is that a person involved can have falls, can have injuries. So that's one important thing what we see in, especially in adolescents or in middle age or in elderly. Even a single episode can make them fall and injure. We have seen people with head injuries, they can have bleeds inside the brain, they can have spinal injuries, they can have shoulder dislocations or musculoskeletal injuries. So that in itself is a reason for them to be medicated and to reduce the impact of the epilepsy on these patients. The another thing is recurrent episodes of seizures have shown that it can lead to memory loss, it can lead to other cognitive problems because of recurrent seizures and epilepsy. So that's one reason why this patient needs to be treated. Then another reason is there can be continuous seizures, that's called status epilepticus. The seizures can just stop at 30 seconds or 1 minute, but there are occasions when a person who is already known epileptic, or even the first episode of seizure can be very prolonged. That can lead to comatose state, and that can be life-threatening situations. So for these reasons, these patients needs to be evaluated and then investigated and then started on treatment. So, the treatment has been available for many years now. So we had traditional medications like phenobarbital, we have phenytoin sodium, we had sodium valproate, and now we have new generation medications like levetiracetam, we have gabapentin, we have topiramate, we have lacosamide, and there are new medications being made available. With so much of medications being available, we pick and choose which is the patient which will benefit with this medication, and we also look that in that age group they don't have side effects. So we look at various options and then choose the appropriate medication. So what are the tips for patients who are started on medications? So important is to accept that these are treatable condition. This is very much treatable condition. You can lead a normal life like any other person, with some riders with some restrictions, of course, like these patients need to be avoiding driving as much as possible, and these patients who are on medications or without medications also, they need to avoid going underwater, like underwater diving, swimming needs to be avoided with patients with epilepsy. So if you take care of these restrictions, rest of the things you can lead a normal life. So what are the tips once you are started on medications, what needs to be done? Before that, I also want to speak about what are the investigations we usually do when in a patient with epilepsy. We have certain set of investigations apart from the routine blood investigations we do. We also look at electroencephalogram, which we look at the electrical activity in the brain, whether there are any intrictal discharges, which again tells us what is the type of epilepsy. We classify epilepsy also depending on the semiology, what is the type of seizures they have. We also look at EEG and then classify what is the type of epilepsy, because that helps us also to choose the appropriate medication. We also look at any imaging abnormality. We do MRI or CT scans for these patients and then look at for any structural problems there. and then we can also prognosticate how many years do they require medications. That's decided on. I think there are specialized investigations, like we also sometimes take the help of functional MRI. We also take help of PET or SPECT scans, functional scans, to look at the abnormal metabolic activity in the brain. We also sometimes choose patients for long-term video EEG recording. If the patients needs to be going for surgery, we look at long-term video EEG recording, and then we lateralize and localize where this abnormal electrical activity is coming from, and then if the patient is eligible, we look at surgical options as well. So once these patients are started on treatment, medical treatment, what is the tips? So important is to maintain the compliance. So you should stick to the drug schedule what the treating doctor is given to you, because ultimately your seizure control depends on the compliance. If you are not compliant and if you are missing your doses frequently, that in itself, even a single dose missed also can lead to breakthrough seizures, which again will add to the number of years of treatment. So you need to make sure that that your treatment is regular, and I think if you have any doubts, you can always contact your doctor and ask. If you have side effects, you can always ask them to, whether medicines can be reduced, the doses can be reduced, but you should not take the decision on your own. And important also is to make sure that you have regular sleep. So one thing which can lead to breakthrough seizures even despite being on medications is that if your sleep is disturbed. So important has to have at least 6 to 7 hours of sleep in the night, and if you are for some reason your night sleep is disturbed, you need to compensate the next day or within the next 24 to 48 hours so that your sleep debt is not prolonged. So that's one important. And also the basic things in thing like regular food habits, you should not delay your meal or skip your meal, because hypoglycemia itself can lead to breakthrough seizures. So if you make sure that you sleep well, your food habits are regular, you exercise regularly, you take your medications properly, you are sure that your treatment is going according to the plans, and in most of the situations in next 2 to 3 years after taking therapy, we can look at reducing the medications and stopping the medications. So usually we generally give for 2 to 3 years, and once we are sure that the risk of you having further seizures either by clinical evaluation or EEG recording or imaging, we take the call that we can reduce the medications and stop the medicines. So that is one important once you are on medications. What if you see a person having seizures? If the patient's family or the caregiver or friends who among them have a patient who has epilepsy and has a seizure in front of them, what needs to be done? I think that's always a common question people want to know. So important is not to panic. If you know that the person has epilepsy, then it's fine. Or if the patient the person around them don't know that he's epilepsy, but important is not to panic, not to trying finding some iron things to give it to the hand. That all doesn't help. Important is they're all not scientific. So important is to make them make sure that the person who is having epilepsy or a seizure attack doesn't fall and injure himself. That's the primary motto. So once you hold them well, if you find some bed or something like that, fine, or on the same floor, they can make them lie down and turn the head to one side, and so that the tongue doesn't fall backwards. They breathe well, and whatever the frothing or the saliva comes out and doesn't choke. So if once that is taken care of, we know for sure in a minute or less than a minute the patient will recover. So what if the patient doesn't recover? But meanwhile when you are taking care of, you can make sure that if there's another person not there, you can always ask them to call the immediate nearby doctor. They can come and see them and then do the first aid. If it is not available also, you don't need to panic. The patient will recover. If for example in a minute or two the patient doesn't recover, I think that's the time when you need to decide that you need to take him to the nearest hospital. So I think if you are calm and composed, if you can take these decisions, it's very easy, and you can always make sure that the patient is reaching the nearest hospital, and then the treatment is taken to the next level. So when there is a situation that the patient he recovers and the patient has back-to-back seizures, like for example, the patient has a minute of seizure and then recovers. As he recovers, he has another seizure. That's also the time that you need to make sure that a patient reaches the nearest hospital as early as possible, or even a clinic where the emergency medications can be administered. So these are important things to understand. Regarding so what is the treatment modalities available? As I said earlier, we have a lot of medical options. We have the traditional anti-epileptic drugs which are available. There are also new treatment medications available now, and we choose according to the profile of the patient and minimizing the side effects. We also have some amount of diet changes where we use sometimes ketogenic diet, where you can reduce the seizure frequency. So when we use medications for the epileptic patients, we have 2-3 things in mind. One is, of course, we need to reduce the primary goal is to have seizure free period. You also look at reducing the seizure frequency. Also important is to reduce the intensity of the seizure. If the person has a significant amount of generalized tonic-clonic seizures which are responsible for injuries and all, that will get minimized. But you can have small episodes like absence seizures or thing which may not be completely controlled, but they are benign attacks. So we still have things, so we adjust the medications or we add new medications and all. So when we use sometimes rational polytherapy to minimize the impact of the seizures or frequency of seizures. The another thing is what is nowadays we look at is also surgical treatments available for epilepsy. So when the person goes into refractory epilepsy, so 20% of seizures population, epilepsy population can go into refractory. That means even despite using 2 drugs, sometimes the seizures are not under control. They continue to have seizures. In that situation, we call them a refractory epilepsy, and then we subject them to pre-surgical evaluation and then look at surgical options. So these treatments are also available all over the country. We can take an advantage of this. We can always ask the treating doctor whether this needs to be looked at, because not every time all the treating doctors are aware of that. If you can always ask about that, there's any other option. So this can be patients can be pooled and then referred to a higher center for surgical options. The bottom line is important is the epilepsy is no doubt a complex neurological condition, but if you follow the doctor's instructions completely and strictly, you can always have a good quality of life. You can make sure that your seizures are well controlled, and then you can get on with your professional activities, your personal activities as much as you can. Thank you.